When it comes to meat-based diets, there's no singular approach, but rather a spectrum of dietary strategies rooted in evolutionary biology. What they all do share, however, is a foundation that lies in the deliberate elimination of modern processed foods, a principle that echoes the historical observations of pioneering researchers like Dr. Weston A. Price and Vilhjalmur Stephenson. In their respective works, Nutrition and Physical Degeneration and The Fat of the Land, both men documented the robust health, physical vitality, and near-perfect dentition of isolated populations consuming nutrient-dense, animal-based diets, a state that deteriorated rapidly upon the introduction of modern foods of commerce. Proponents of this diet argue that for millions of years preceding agriculture, humans were primarily hunters and fishermen. Anthropological evidence suggests that human ancestors lived mainly on the meat and fat of animals. Paleoanthropologist Dr. Mikey Ben-Dor used stable isotope analysis to prove that humans were apex predators, with a trophic level higher than wolves during the Pleistocene era. The shift to agriculture and the accompanying increase in carbohydrates is a recent development in human evolution, starting less than 20,000 years ago. This large-scale shift to plants and grains marked a profound change from the previous diets of hunting and herding humans, and it is directly linked to the development of modern degeneration, including malformed jaws and bad teeth. The underlying rationale is the hypothesis that plants, unable to flee predators, utilize chemical warfare by producing defense compounds to prevent them from being eaten. These have come to be called anti-nutrients, which are harmful to human health. These include lectins, which are proteins that are believed to damage the gut lining, oxalates, which are crystalline compounds that are linked to kidney stones and joint pain, phytates, which are known to bind to minerals, especially calcium and iron, preventing absorption, and glycoalkaloids, which are neurotoxins found primarily in nightshades. There's also chemicals such as salicylates, sulfites, FODMAPs, glucosinolates, phytoalexins, gliadin, and agglutinins, which are believed to contribute to the opening of the tight junctions of the gut lining, causing leaky gut and systemic inflammation. The concept of nutrient bioavailability is a fundamental component of all meat-centric diets. Animal-based nutrients are preformed and highly absorbable by the human body. Iron is absorbed at a superior rate to plant sources, and animal fat contains preformed retinol, which is the usable form of vitamin A. Organs, particularly liver, are a substantial source as well. Vitamin D is not found in plants, it's only in animal foods. These, along with vitamins E and K, are fat-soluble activators, which minerals such as calcium, zinc, and magnesium depend on for sufficient utilization. How you may implement a meat-based diet is contingent on many factors, including your health goals, metabolic profile, willingness for dietary restriction, and comfort with medical monitoring. There are differing levels of strictness in application, requiring different considerations for adherence and safety. The most important consideration is aligning the diet's strictness with the desired outcome. For instance, a strict carnivore diet is ideal as an ultimate elimination approach to identify food sensitivities and achieve a profound reduction in systemic inflammation and improvement in conditions like obesity and diabetes. Whereas the animal-based meat diet is more conducive to lifestyle optimization and metabolic flexibility. Some people include minimal carbohydrates to support electrolyte retention and suppress cortisol, avoiding the chronic deep ketosis sometimes associated with hormonal issues in active individuals. It is important to discuss the long-term effectiveness of any highly restrictive nutritional plan, which depends entirely on the body's physiological adaptation and the potential emergence of diminishing returns or tolerance development. The most concrete evidence of the body's adjustment is seen in the gut microbiome's response to a static, restrictive diet. This suggests that a static diet requires dynamic adjustments to avoid negative adaptations or side effects. This could consist of consuming some fruit occasionally or incorporating fermented foods. The result of achieving nutritional ketosis requires rapid metabolic change, which leads to weight loss and insulin sensitivity. But maintaining that long-term adaptation requires periodic low-level energy inputs and delicate dynamic adjustments, such as glucose or nutrient supplementation, to counteract the shift in your microbiome, potential nutrient gaps, or psychological effects that could cause one to want to quit the diet entirely. While the research is still evolving, there is some evidence that extended, very low carbohydrate intake can, in some individuals, be associated with lower levels of triiodothyronine or T3, the active thyroid hormone, as well as potential changes in reproductive hormones. An approach that includes periodic carb intake from fruit or honey, for example, may help support thyroid function, provide sufficient glucose for tissues that prefer it, and avoid some of the adaptation issues associated with chronic, very low carb intake for people who don't thrive that way. This is also beneficial for athletes or people who practice strenuous exercise or strength training regularly. Moderate carbohydrate intake replenishes muscle glycogen, which supports high-intensity exercise, strength training, and endurance efforts. Multiple performance studies show that carbohydrate availability can improve training output and recovery. It is important to monitor for reintroduction sensitivity, especially if you spend a significant amount of time on just meat alone. Reintroducing even low-toxicity foods requires patience and self-observation. But definitely stay within low-toxicity choices, such as avocado, lemon or lime, coconut, mango, or pineapple, as well as fermented foods such as kimchi or homemade raw milk yogurt. Now, let's talk about the benefits of an animal-based diet grounded in the available research. What positive effects are supported when we prioritize high-quality animal foods? What's revealed is that meat-centric diets yield specific benefits related to metabolic function, nutrient optimization, and inflammation resolution, resulting in the reported improvement or reversal of a wide array of chronic conditions. The benefits are derived from the twin mechanisms of total elimination of anti-nutrients and maximization of bioavailable nutrients. The elimination of dietary glucose, in the form of carbohydrates, causes insulin levels to drop significantly. This is the primary driver of rapid fat loss, leading to a profound reduction in visceral fat and reversal of insulin resistance. This pushes the body into deep nutritional ketosis, where the liver produces ketone bodies called beta-hydroxybutyrate. Ketones serve as a cleaner, more efficient fuel source, particularly for the brain, which helps to reduce neuroinflammation and stabilize energy. High protein and fat intake trigger powerful satiety hormones, specifically peptide YY and GLP-1. This leads to very high satiety and spontaneous calorie reduction, often resulting in participants effortlessly eating 30 to 50% fewer calories. The combination of extremely high protein intake and ketosis creates an anti-catabolic, muscle-sparing environment during calorie deficit, allowing individuals to lose significant fat while maintaining or gaining muscle mass. Studies in older adults find that higher animal protein intake is associated with better muscle mass and function, which is especially important as we age. Animal foods, especially organ meats, provide near-perfect ratios of bioavailable protein, heme iron, zinc, B12, choline, carnitine, carnosine, creatine, taurine, and vitamin K2. Red meat is an incredibly dense source of zinc and vitamin B12, which are crucial for immune function, red blood cell formation, and neurological health. Liver and other organs are especially rich in vitamin A in its active form, folate, and most B vitamins, as well as copper, choline, and CoQ10. Organ meats are among the most nutrient-dense foods on the planet per calorie. Many consider egg yolk a superfood. They are especially rich in choline, vitally important for brain health and liver fat metabolism. Grass-fed raw dairy, especially certain aged cheeses, ghee, and butter, provide copious amounts of bioavailable calcium and vitamin K2, which may play a role in directing calcium to bones and away from arteries. Now, seafood I mention with a caveat. Because of ocean pollution, most fish, especially larger fish, contain high levels of mercury and other heavy metals. The only fish I would recommend would be wild-caught Alaskan sockeye salmon, salmon roe, and occasionally sardines. These are high in iodine and long-chain omega-3 fats like EPA and DHA, which are important for cardiovascular and brain health. Meat-based diets can replicate the effects of a ketogenic diet to some degree. As such, they have similar effects on diabetes, weight loss, and hypertension. In a carnivore diet survey, participants with type 1 and type 2 diabetes reported reductions in median BMI and glycated hemoglobin, along with an 84% to 100% reduction in medication use. A pioneering carnivore study by Dr. Belinda Lennertz and Dr. David Ludwig at Harvard, the first major formal study on carnivore dieters, found that 95% of participants improved overall health, 93% improved or resolved obesity, and 96 to 98% saw improvement in their diabetes. Doctors at Paleo Medicina are doing groundbreaking work using a meat-only diet. They treat and regularly reverse severe chronic diseases, including Crohn's disease, Hashimoto thyroiditis, rheumatoid arthritis, and an array of other autoimmune diseases. Cohort data shows 60 to 90% improvement or full remission of rheumatoid arthritis and psoriasis in compliant patients. Other clinicians have reported resolution rates for irritable bowel syndrome and disease of over 90%. Findings confirm success treating conditions such as epilepsy, chronic pain and inflammation, depression, anxiety, stuttering, and brain fog. The nutritional philosophies underpinning meat-centric diets yield specific benefits related to metabolic function, nutrient optimization, and inflammation resolution, resulting in the improvement or reversal of a wide array of chronic conditions. It is clear that a meat-based diet works. Whether you use strict carnivore as a reset or move straight into an animal-based pattern, the central idea is the same. Build your diet around the most nutrient-dense, bioavailable foods we have, foods that humans have relied on for millennia, and then adjust the details to support your metabolism, your training, and your life. If you want to see a full 7-day animal-based meal plan and a breakdown of the key nutrients in each dish, let me know in the comments and I'll build a video around it. Thanks for watching, and I'll see you in the next one.